Diabetes is a chronic disease that impacts the way your body makes use of energy in your food. When you eat, your body breaks down the carbohydrates in food into glucose. Glucose is the main source of energy for cells. Insulin, on the other hand, is a hormone produced by the pancreas, which allows glucose to enter your cells to be used for energy. In diabetes, the body either doesn't produce enough insulin. This is called type 1 diabetes. Or your body produces insulin, but it doesn't function properly. This is called type 2 diabetes. Both lead to increased levels of glucose in the blood. Over time, high blood glucose levels can cause significant health problems, affecting different organs in your body. In fact, elevated levels of blood glucose cause most of the symptoms of diabetes, even though the prevalence of diabetes is almost the same between men and women. There are factors that affect the development of diabetes in women, for example, pregnancy, polycystic ovary syndrome, and cardiovascular diseases. According to the International Diabetes Federation, around 214 million women between the ages of 20 and 79 were living with diabetes worldwide in 2019. This number is expected to reach 313 million by 2045 if current trends persist. This is why in this video, we will reveal to you 10 common diabetes signs in women you should not ignore. So, without further ado, let's get to it. Number 1. Frequent urination. Scientifically, frequent urination is called polyuria. Your kidneys are responsible for filtering the excess glucose from your blood. However, for glucose to be excreted, it must be accompanied by water to dissolve it. As the kidney moves glucose from blood to urine, the glucose concentration decreases in blood and increases in urine. So, more glucose excreted in urine means that more water is excreted. More water excreted means more urine will be produced. This is why a diabetic woman will find she makes toilet visits more often, including during the night. Number 2. Increased thirst. Do you feel that no matter how much water you drink, you still feel thirsty? Increased thirst is medically known as polydipsia. High blood sugar levels create an osmotic effect, pulling water from the body's cells into the blood to dilute the excess glucose. This increases your blood volume and blood pressure. The body's cells may also become dehydrated due to the movement of water out of the cells into the bloodstream. To prevent this, your brain makes you feel thirsty, which makes you drink more water. This is an attempt to maintain fluid balance. However, despite increased water intake due to thirst, diabetic women are still at a substantial risk of dehydration. This is because the frequent urination associated with diabetes leads to fluid loss. Number 3. Unexplained weight loss. Unexplained weight loss can be a symptom of numerous health conditions. However, when accompanied by the other symptoms in this video, it could be a strong sign for diabetes. Significant and unintentional weight loss of 5% or more of total body weight within 6 to 12 months is a cause for concern. In both type 1 and type 2 diabetes, the body either doesn't produce enough insulin as in type 1 or can effectively use the insulin it produces in type 2. Remember that effective insulin is needed for moving glucose from the blood into cells to be used for energy. Without it, glucose stays in the blood, and the body's cells are starved for energy. Because of this starvation, the body starts breaking down stored fat and its muscles to provide energy. This causes weight loss, even if the person is eating a normal or increased calories. Some diabetic patients have an increased appetite as their body tries to compensate for the lack of energy from glucose. Number 4. Fatigue. Does unexplained severe tiredness sound like something you're experiencing? This is actually a common symptom of diabetes, due to glucose remaining in the blood and not being used by the body's cells. The person experiences fatigue and weakness. In addition to that, diabetes can disrupt sleep patterns, leading to poor sleep quality or sleep disorders such as sleep apnea. Sleep apnea is a sleep disorder characterized by pauses in breathing or shallow breaths during sleep. Moreover, diabetic patients constantly get up at night due to frequent urination. This interrupts their sleep cycle and causes daytime fatigue. Number 5. Yeast infections. Diabetic women may experience increased yeast infections, especially vaginal yeast infections. High blood sugar levels for prolonged periods of time allow for a yeast species called Candida to grow and multiply. Increased glucose levels in the vaginal secretions can promote the overgrowth of yeast. This leads to the development of vaginal yeast infections known as vulvovaginal candidiasis. Adding to that, diabetes can affect the pH balance of the vagina, making it more alkaline. This makes yeast growth even easier. Number 6. Changes in menstrual cycle. Diabetic women can notice changes in the frequency, duration, and intensity of their periods. Diabetic women, especially those with type 2 diabetes, can have disrupted hormone levels. This includes insulin, estrogen, and progesterone. This can influence the normal regulation of the menstrual cycle, leading to irregular periods, skipped periods, or changes in heaviness of blood flow. Disruption of hormone levels may also be caused by obesity. Obesity is a common presentation of type 2 diabetes patients. Hormones are made from fats. The increased availability of fats increases the production of estrogen and androgens. This makes them go beyond the normal range and affect periods. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 7. Blurred vision. Blurring of vision is a symptom that must never be taken lightly. High blood sugar levels can result in changes in the normal shape of the lens of the eye. When blood sugar levels are increased, excess glucose can enter the lens and attract water due to its osmotic effect. This causes the lens to swell. This affects the refractive properties of the eye. Consequently, temporary changes in vision and blurred vision occur. Patients with diabetes may be surprised by temporary myopia, which is nearsightedness, or hyperopia, which is farsightedness. Furthermore, diabetes increases the risk of developing cataracts. Cataracts refer to the clouding of the eye's lens that can cause blurred or cloudy vision. Number 8. Slow healing of wounds. Have you noticed that your wounds are taking forever to heal? You might want to get your blood sugar levels checked. Diabetes can damage blood vessels and impair circulation, especially in the extremities such as the feet and legs. Poor circulation decreases the oxygen and nutrients delivered to the site of a wound. Without the proper nutrition, the healing process is slowed down. Additionally, not only does diabetes damage blood vessels, but it can also cause nerve damage. This leads to loss of sensation. If you can't feel part of your body, you won't feel it when you get injured. This can cause wounds to go unnoticed and untreated for longer periods, further delaying healing. Number 9. Frequent infections. Having frequent infections is another indicator for diabetes in women. High blood sugar levels prevent white blood cells from functioning properly. These are the cells responsible for fighting off infections. So, the person becomes an easier target for microorganisms. Moreover, high blood sugar levels are a perfect environment for bacteria and fungi to grow. High glucose levels in the urine, a condition known as glucosuria, can cause the growth of bacteria in the urinary tract, leading to recurrent urinary tract infections or UTIs. Furthermore, bad circulation due to diabetes decreases the delivery of white blood cells and antibodies to sites of infection, making it harder for the body to clear infections. Number 10. Tingling or numbness. If you have been feeling tingling or numbness, this may point to diabetes. Like we said before, diabetes can cause damage to the nerves in your body. This is known as neuropathy. Most commonly affected nerves are those in the extremities, such as the feet, legs, hands, and arms. This is because of high blood glucose levels. Diabetes can also affect the small blood vessels that feed the nerves. Reduced blood flow to the nerves can impair their function and lead to sensations of tingling or numbness. The most common type of diabetic neuropathy is distal symmetrical neuropathy. It affects both sides of the body symmetrically. In diabetic women, this usually appears as tingling or numbness beginning in the toes or feet and gradually moving up to include the legs and even the hands and arms. So, these were the 10 diabetes signs for women. Recognizing and managing diabetes is essential for a healthy life and to avoid major complications. So, have you noticed any of these symptoms developing recently? Were they because of diabetes? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.